Now, you've got an article in preprint, and it's about sort of the situation down there. What can you tell us is going on in Tijuana?
So just to clarify, it's a preprint, so that means that it's not peer-reviewed. And what we did in that article was that we basically counted two things. Those were their two main outcomes. So the two things that we were looking for were the pre-hospital mortality, and the second thing was the respiratory cases that our pre-hospital ambulance was taking care of. From my paramedics and my EMTs was that there were an increase in patients who had profound hypoxemia, something that we hadn't seen before, and that happened around mid-April or so. And in addition to that, we were seeing also more patients who were found in cardiac arrest. And this anecdotal evidence from our EMTs and our paramedics led us to start looking at the numbers and start counting these two outcomes. And so what we saw was that during April 14th and May 5th and May 11th, we started seeing a rise in out-of-hospital mortality, which was above the expected. We compared this with the official numbers, and according to the central government, the official out-of-hospital deaths during this period was 8. And the out-of-hospital mortality that we saw as pre-hospital care was 329. What we are describing are excess pre-hospital mortality, which can be either secondary to COVID-19, or it could be secondary to trauma, or STEMIs, strokes. So one of the things that we cannot say is that the excess mortality that we saw in our pre-hospital setting is all secondary to SARS-CoV-2. But what we can say is that these did occur during the COVID-19 pandemic.
So this is very similar data, it sounds like, to Italy. There was an Italian pre-hospital care study that found the same thing, an enormous spike in pre-hospital cardiac arrests during the time of the worst part of their pandemic.
Yes. So the difference with the Baldi paper that you're referring to is that they saw an excess pre-hospital mortality of 58%, and we saw an excess mortality of 145% when compared to prior trends. Nowadays, our numbers in TJ are going down. It seems that the healthcare system isn't at capacity as how it was 2 weeks ago. But now it seems that the epidemic has traveled to Mexicali, which is the next, which is, I guess, east to TJ and just south to El Centro, which is in California. And over there, it seems also that the healthcare system in Mexico seems to be at capacity, and they're seeing a surge of patients in El Centro, which is in California. And this surge is mainly driven by U.S. citizens who live in Mexico. Just looking at the numbers, Mexico City also seems to be currently in its peak. There are, again, what they did, the strategy was basically to convert all of these a few of the tertiary care hospitals and secondary hospitals into only COVID-19 hospitals. But there has been some newspaper outlets that have described an increase of deaths, for example, seen by funerary homes. So there, again, it's more of like anecdotal evidence suggesting that the impact or the magnitude of the epidemic is not well reflected by the numbers.